Having pain in your right abdomen? What it could mean. Aches and pains are common woes of our lives. While most of the time, there is nothing serious about experiencing pain, however, a sharp, localized pain could be worrying. Particularly, pain in the right abdomen could cause some amount of confusion, given that it can be a symptom of several health problems. Let us find out about 5 such conditions. Acid reflux. One of the most common reasons behind pain in the right abdomen is heartburn, which is often caused by acid reflux. According to the Mayo Clinic, acid reflux, also known as gastroesophageal reflux, GERD, occurs when stomach acids flow back into the tube that connects your throat to your stomach. This leads to a burning sensation in the chest or throat. Fatty liver disease. A fatty liver disease occurs when there is excess fat buildup in the liver. While people with fatty liver disease do not develop symptoms until the disease leads to cirrhosis of the liver, if one does have symptoms, it could include abdominal pain or a feeling of fullness in the upper right side of the abdomen, belly, says Cleveland Clinic. Appendicit. The Mayo Clinic defines appendicitis as an inflammation of the appendix, a small pouch that hangs from the colon on the lower right side of your abdomen. It can cause pain that typically starts in the middle of your abdomen and travels to your lower right-hand side. Certain types of cancer. According to leading health bodies, certain types of cancer can also cause pain in the upper abdomen. According to Johns Hopkins Medicine, a common symptom of pancreatic cancer is a dull pain in the upper abdomen, belly, and/or middle or upper back that comes and goes.